Now this will detint at 45 degrees. So I would do that. Detint it at 45 degrees. Get it down over here. Now we're gonna do the left hip. So get your left marker. We're gonna put a grid on this, right? You're gonna tell me you're gonna put a grid on it. And do you see where the middle of this is? Put your marker about here. And then when you're collimating, just see if it's in your light field or not. If it isn't, move it in. Because we want to do a lot of collimating here. All right, so I've got a left marker on. Different ways you can go about doing this. I am going to have somebody hold this actually for me. I'm going to get them over here. I'm going to have to come right over here.
Switch around.
Okay, I don't like this lip here, but what I'm going to do is, okay, you want to find crest. And there it is. Now I'm going to have you bring your arm up a little bit out of the way. Now let's just pretend this isn't here, okay? Because we would have to get away from it. And with a big cassette like this, it's going to be difficult to do it. So this is just a guesstimate of where I might want this. It's a pretty good guesstimate, but that's what you want to do. All right, so tube. That's done. All right, so now we want to be perpendicular to the long axis of the neck of the femur, right? Perpendicular to the long axis of the neck of the femur. All right, and then what I'm going to have you do is just flex your leg, just like that. And I'm just going to orient, this helps you orientate your center ray. You see where it is? Not in the right spot for sure. And then try to make sure you're in the middle of the femur, up and down. I'm not quite there yet, and now, Darcy, can we have you draw your leg back to your chest if you reach down and grab your, like your thigh or your knee, whatever works best for you. All right, so I'm going to quickly bring this right into the crotch. And do you see how I'm in the middle of that thigh? That's what you want. Want to be in the middle of the thigh? Let's just bring your leg down just for a minute. Because the reason why, now in the real world, you really won't have them bring their leg back down. But we are going to, because we're going to make sure we're in the middle of this cassette. So we're going to go up like this. Pop it out a little bit more. There we go. All right. And now, and you see I can collimate to my marker there. All right, let's go ahead and bring this leg back up. Grab that over again. And we'll go with that. We already know our markers in the light field because I just verified that. All right, you can relax. Now this is our axiolateral hip, Danelius-Miller center ray. Horizontal center ray, but perpendicular to the long axis of the femoral neck. Got our marker on. We're good to go. And now we're going to do our Clements-Nakayama. So leave this like this, except bring it up and put a 15-degree posterior angle on it, or I call it caudal, but it's posterior caudal. The first slash mark is your 15 degrees. All right, so we got that done. We already got a grid on this, right? We already know we have a grid. Now, Darcy, we need you all, this is going to come out, you hold on to that. But bring it off, all the way off. Just really over to the, and you see this is where you're thankful for sheets on tables and cards, because you take the sheet and you scooch the patient over. Now your arm's going to hold up together. Can we get your upper body over just a little bit more? Okay. All right, so what you want to do here is, we have a lot of OID. That's one thing that you end up with is a lot of OID. But we went 15 back, right? This is where you, if this was a lengthwise grid, if the grid lines were running lengthwise, this is where I would flip it crosswise. Because you can not, your angles can be a little messed up. As long as you're angling along the grid lines. But if you're angling against them, the sequence has to be absolutely the same. Like that 15-degree angle has to be exactly this 15-degree angle, which is hard to do. So pay attention to your grid lines. All right, I'm just gonna put this about right here. I'm gonna have you come around. And at some point, I'll probably have you move it. But that's a good starting point. You see how it's going below the table. Just move this in. I'm just trying to get some of the slack off of your pants so they're more snug. This is where, if your patient is wearing a gown, great, because just make sure you can see right where the legs meet. Tuck your hand, tuck that gown down in between the legs, and you are good to go. All right, so we want to be down just like that, because this is what you want to think. Here's the femur, neck, and this is going down through the neck of the femur, all right? And even though we're off a little bit, that's fine. But open up to get the marker on. Actually, you don't want to see any light. Sorry, Darcy. You don't want to see any light. Just move that marker into where you know that light is. Good to go. This is what you want. All right, you can relax, Darcy, and I'll take this. Now, what do we call this? Oh, I forgot something. When I did her first X-ray for Danelius-Miller, I should have had Darcy go in. I forgot it. On this one, we don't do it. It's never done. But again, this is called the Modified Axiolateral Hip, Clements-Nakayama Modification. The whole thing is what we call this. But just remember, 15-degree posterior angle. Move your patient to the edge of the table. Drop this down beyond the edge of the table, 15 degrees back, and keep that flared out at that 45 degrees. And then once you get this tube right into the crotch of the patient, that's when you can then go look and see where do we have to move this around a little bit. So, all right. So, and Darcy, we'll get you out there now.